Hi, this is Josh, Dream Body Clinic. In this video, we're going to talk more about MUSE cells. So MUSE cells are a pluripotent stem cell, meaning they can turn into whatever kind of cell you need them to, just like you think with a stem cell. We've been offering mesenchymal stem cells for over 8 years, and a mesenchymal stem cell is more like the manager on the construction site. It doesn't turn into other cell types. It's more guiding the repair process, creating the right environment. Well, MUSE cells are found within mesenchymal stem cells. And the way Dr. Dezawa, who you're going to see later in this video, explained, she discovered them in 2010 because they accidentally killed a bunch of mesenchymal stem cells by leaving them out, but the MUSE cells survived. So if you stress mesenchymal stem cells enough, usually with a low oxygen environment, they will die off and you're left with MUSE cells. And what she's explaining here is why you don't want to mix the two. Because a real common question is, hey, can I hedge my bets and do like an IV of mesenchymal stem cells and the MUSE cells? And the answer is yes, you can, but it's not a good idea. Because if I did say a 300 million IV of mesenchymal stem cells and a 20 million IV of MUSE cells, these 20 million will just act like this 300 million MSCs. They found that the ratio matters. If you're doing around 30% MUSE cells to 70% MSCs, it might work a little bit better than MSCs, but pretty similar. If it's 50-50, you could have better results than just MSCs, but nothing wow. And if you go 70% MUSE cells to MSCs or higher, that's when you get to the wow factor, as Dr. Dezawa likes to say, as you'll see in this video. So 70 to 100% MUSE cells is going to get you true MUSE cell results. And the cool part is not much of a difference between 70% to 100. So we isolate them as best we can, but that means we can have them at like 70-75% MUSE cells to MSCs and still get full MUSE cell potential. So we're getting much higher percentages than that, which is a good part. Upwards of 90% pure MUSE cells. And we're offering those now for patients. And they go through your system. IV is the best way to do them. You'll see some other videos, Dr. Dezawa explaining this. And they'll seek out inflammation, they'll find it, and then they'll eat the bad cells and turn into the damaged cell type. So with like heart attacks, they'll eat the bad cardiomyocytes and they'll turn into new cardiomyocytes. They're finding this with Alzheimer's in the brain. They're fixing neuronal damage and turning into new neurons. They're finding nerve damage and turning into new nerve cells to help regenerate nerves. It's really incredible. Doing it for organs, for nerves, for skin cells, sweat glands, hair cells, and in so many things. It's really incredible. So stay tuned, watch her explain in her own words, and you can see if you'd like to learn more about MUSE cells, you can go to our new website, www.dbcmusecells.com. I'm Josh, happy to help.
To inject 100 million, 1,000 million MUSE cells, very high number of MUSE cells, so-called MUSE cells, very often, the effect will be less and nothing. It depends on MUSE cell percent. If the MUSE cell percent is nearly 100% or over 70%, 70% is one of the border. If it's over 70% purified MUSE cell content, 30% or less than 30% non-MUSE cells, I mean MSC contamination, you will have 100% pure MUSE cell outcome. It's almost similar. 70% MUSE cell, 80% MUSE cell is almost 100%, equal to 100% MUSE cell outcome. But if you treat the patient with 30% MUSE cells, that would be almost equal to MSC. MSC. If it's 10%, it's equal to MSC. 30%, just a little bit better than MSC, but you will not see any of the wow. You will never see wow. But if you treat with at least more than 50%, this is good.
Big difference.
Not wow, but it's good. It's good. But if it's over 70% MUSE cell percent, then you can make people wow. This is guaranteed. In Japan, the Japanese doctors, they're very polite, they're very gentlemen, they're very smart, but they're very skeptical, right? So they didn't believe the MUSE cell at first. But once they treat, dermatologists with epidermolysis bullosa, cardiologist for myocardial infarction, stroke, ALS, they just got, wow, they change, their face change. I could learn from, their atmosphere that they're making wow. It never happened, never happened.